Hey everyone, it's Cohen. I figured what I would do is I've already done my one month post-op video, but I know some guys that are going to be having top surgery in the next little while, and my 2 month isn't till March 5th, and some of these surgeries are beforehand. So what I thought I would do is I have a piece of paper here. It looks like a lot, but I'll try to be as quick as possible. It's just pointers for before surgery, right after surgery, and what I've followed pretty much for the last month. And also just what I've asked questions of from Dr. McLean and Lorelai, who is the main nurse usually, who is there for the surgery and knows all the goings on, everything to do with before, during, and after surgery. So I'm just going to start going. Some of it's in order, some of it is not. It's pretty much, I'm just going to let you guys know as much as what I know for before and for your first month after surgery. So I went to Dr. McLean in Mississauga at the McLean Clinic, and I had a double incision mastectomy with nipple grafts. That surgery after tax came to $7,910. I have status, so with my status, I was able to have the tax covered. So technically, I paid $7,000. After surgery, once you've healed, there's scar recovery gel that McLean promotes and sells. For a bottle of it, it is $98 before tax. After tax, I believe I paid around $118 maybe. Not 100% sure, but I do know that it wasn't any more than that. I don't have the receipt on me right now, unfortunately. Pretty much before surgery, what's going to happen is you make your consult. You go and you talk with Dr. McLean. You're going to show him your chest, so make sure that you're aware of that. If you are a little bit uncomfortable, just know it's not long. Literally, he leaves the room, and then he comes back in, and all he's going to do is look at your chest to see what he will have to be working with. Because if you are a small A roughly, sometimes Bs are okay depending on your shape and how much tissue there is. You can get the keyhole, or you can get the double mastectomy. So the main purpose for showing him is so he knows what to work with, and he can recommend which surgery will probably turn out best for you and which one he would prefer to do on you as well. So when I went in for that, I met Lorelai, who, like I said before, is the nurse that works with Dr. McLean during the surgery. I met Dr. McLean, and then I also met Liz, who is the accountant, and she deals with all the money, the appointment booking, and everything like that. So at my consult, I did that, and then after my consult, because I didn't get my surgery right away, I went for my consult actually last May, and so I waited a little bit of time, but I was very comfortable with Dr. McLean. I knew that I wanted to go see him, and then I believe it was in August I went to go see him, and at that point was when I actually booked my surgery date, and at that point you end up paying 10%. So what I paid was $700 because I only paid $7,000, but you will end up paying 10% when you book, just to pretty much it's reserving your date and making sure like you're giving something so that he can give you the date. Pre-surgery was awesome. They give you all the information. You ask as many questions. I had a page front and back full of questions, and they answered every single one of them. So when you do your booking, you're going to be doing your deposit, and then you are going to go for a pre-op appointment. When you book with them, they are going to give you a piece of paper that is for blood work and a piece of paper that is for a regular checkup at your doctor's office. This is to make sure that you are just ready to go into surgery. Your doctor's appointment actually isn't invasive. The form is very simple. It's pretty much dealing with everything to do with your chest. It's not like you have to show your doctor your chest. They just want to make sure like your heart's working properly, that everything to do with from here to like all of your innards are working properly for surgery. That's the only thing. So don't worry that you're going to have to go in and have this invasive appointment. Literally, mine took me about 10 minutes, so it's really easy. It's nothing invasive at all, so you don't have to be worried about that. And then I went in for my pre-op. So my pre-op when I went in was where I paid for the rest of my surgery, and I filled out all the forms for consent for my surgery, pretty much saying, I know what's going to go on, I know what's happening, and I'm okay with it. And then once that's done, the next time you go back is going to be for your surgery. So when you go in, they take you into the back, they get you all prepared, ask you if you have any more questions. They get you to put on the gown, and at some point they come in and they put the IV in, and then they're going to give you fluids to make sure you're ready to go in for surgery. This time for me took about an hour. I was a little bit early, and there was someone who was in for surgery before me, so I did have to wait about an hour. I found it was super easy. I didn't have any regrets. I wasn't waiting. The only thing was that the IV, they put it into a vein right in the ditch of my elbow, because my hands, there were too many cutoffs in my veins for them to ensure that everything's going to pump through my system at a proper pace. So I didn't really like having the IV in my elbow. It was an uncomfortable feeling. But at the end of the day, like, that was the only thing that was bothersome, waiting an hour. So bring a book, bring something to keep your attention, because you will be waiting a little bit before you go into surgery. The next day after your surgery, you're going to go back in for a checkup so that they make sure that there's no fluid collecting, you don't have too much swelling, and that everything looks good. After that, you're going to go in a week later, roughly, anywhere from 7 to 9 days later. I went in 7 days later, where they took off the sponges that are on your nipples to protect the nipples, making sure that nothing comes off, everything stays secured for that week to 9 days. And then after that 1 week, once you have had your sponges taken off, you will go back in at the roughly a 3-week point, in which they're going to let you know if you can stop wearing your binder, if you can stop putting polysporin on your nipple grafts. And then from that point, it's pretty much easy sailing as long as you take care of yourself. And then I know that I'm going back in for roughly just before my 2 months to make sure that everything still looks great and that it's healing properly. Now I'm just going to go through pre, day of, and random stuff. So pre-surgery, I found it was very handy to make sure that I had bendy straws, because it's a little bit difficult to pick up heavier objects. So if you have like glass, or even if you can get like paper or plastic cups to put your drink in, because the less lifting you have to do, the better. Bendy straws were awesome. You will need polysporin. Get the larger tube with the green label. That's the one that McLean asks that you use. Make sure that your prescriptions are filled. You pick yourself up some Tylenol, and you're going to want to grab yourself some laxatives, because the anesthesia that they give you is going to block up your system. So you definitely are going to want to make sure that you have laxatives, because you're not going to want to bother going out to a store a couple days post-op feeling like you feel and going to buy them. So get them beforehand. I also found an awesome thing to do was to get easy accessible snack foods, or foods that you really don't have to fuss with, so that if you are alone, then you don't have to worry too much about relying on somebody else as far as eating, drinking, those types of things. The day before your surgery, you're going to make sure that as of 12 midnight, or 12 hours before your surgery, you do not want to eat or drink anything. So after 12, I was not allowed to eat or drink anything. I also found that it was very, very handy. They're called husband pillows. I'm sure you've seen them in the store. They're the pillow on the back and the arms that come out at the side. I paid $15 for mine. I did not use it a lot at home because I have a recliner, but if you do not have a recliner or something that allows you to lean back so that you can sleep propped up, grab a husband pillow, because that's really going to help you as well. It benefited me so much on my ride home from surgery, because when you're driving, all the bumps in the road seem so much bigger than what they are, because of all your surgery and you're sore and everything, and you're all loopy from coming out of your anesthesia. So I recommend highly to get that pillow. It kept me completely secured in my seat, and I honestly did not feel one bump. And my ride home was about 40 minutes to an hour from McLean's, so that benefited me a lot, and I'm really glad that I did that. So for the day of the surgery, you want to make sure to bring that with you. You want to bring your prescriptions that you have, because one of your prescriptions is going to be an anti-nausea. So the nurse is gonna give you that before you go into surgery, so that afterwards you don't feel as sick as you might if you did not take it. Also, you can bring with your painkillers. I didn't need to take any when I was there because I was still under, but it's always good to have them just in case. Also, make sure that you wear track pants, because pulling up your pants after surgery and dressing yourself is a little bit awkward because you can't move a lot. So if you have track pants, make sure that they do not have the elastic around where your feet come out. You want anything that you're wearing to be super loose and easy to get on. So track pants and a zip-up hoodie or a button-up shirt, I highly recommend, at least for the first 4 days. I wore zip-ups and button-ups for over a week just because I was nervous about trying to get a shirt on over my head and how much stretching I'd be doing. So if you don't have any hoodies or anything that buttons up, make sure you grab yourself a couple ones. If they're not your thing, just grab them so that they're for surgery, but otherwise, they're definitely the best thing to get in and out of. Like I said before, bring a book. Bring a book, watch a movie on your phone, do something, because you're going to be waiting before you go into surgery. And you obviously, for the day of your surgery and your checkup the next day, you want to make sure that you have someone who is able to drive you to McLean's and back, because you will not be able to drive. So for the day of your surgery and the next day you end up going in for that checkup appointment, you need somebody who is going to be able to drive you. And for at least the first 24 hours, you want somebody who is going to be able to be with you and be able to help you for your first day out of surgery, because it's not as easy to do things. The pain isn't that bad, but your mobility definitely is not there. So make sure that you do have a reliable person who is willing to stay with you for at least the first day and help you out. So I'm just going to go off with some things